Procedural room timeout. Goal: to hardwire the timeout process for anesthesia procedures. Promote effective team communication as a critical component of safety. Prevent minor and major complications. Timeout. The desired outcome of performing a procedural timeout is to improve communication among the team and protect the safety of the patient through systematic verification of essential information regarding the patient and the specific procedure that is scheduled to be performed. Why is a timeout necessary? Reduces the risk for making preventable errors during the procedure, including the following: performing the procedure on the wrong patient, performing procedure on the wrong site or side, performing the wrong procedure, lack of preparedness for performing the procedure, lack of preparedness to respond to an emergency and/or complication. Team members. The timeout must be performed by the performing resident or fellow, the PACU or procedural nurse, and the supervising attending. The attending must be present during the timeout and throughout the procedure after the completion of the timeout. After the timeout, the nurse may leave the room and must record in the perioperative nurse documentation. Information to be confirmed. Correct patient identity using 2 patient identifiers. Planned procedure or block and consent are in agreement. Correct side identified and marked. Conduct a timeout immediately before starting the invasive procedure. A designated member of the team starts the timeout. Use the acronym STOP. Confirm the side and site of the procedure. The timeout involves the immediate members of the procedure team, the individual performing the procedure, the anesthesiology attending, and a circulating nurse. The timeout requires 2 identifiers and 2 witnesses, one of whom must be a nurse. All residents participating must be present from the beginning. During the timeout, the resident performing the procedure must identify him or herself as the operator and must stay in the room at all times. Lastly, the name of the procedure to be done must be confirmed, and the attending anesthesiologist has to be present to supervise said procedure until its completion. Thank you for your attention and your compliance. If you have further questions, please ask your chairperson.